Welcome to today's informative session. We're delving into the often overlooked but deeply impactful world of functional hearing loss. This condition presents a unique set of challenges, as it manifests without any detectable physical cause in the auditory system. Throughout this video, we'll explore coping mechanisms, understand its psychological impact, breeze through communication strategies, discuss the importance of professional support and lifestyle adjustments, highlight strengthening relationships, emphasize self-care and mindfulness practices, and look towards navigating a positive future. Join us as we begin our journey into understanding functional hearing loss. Part 1 of our journey introduces us to functional hearing loss, a condition characterized by hearing impairment with no identifiable cause within the auditory system itself. Imagine the confusion and frustration of experiencing hearing difficulty while standard audiometric tests come back normal. That's the reality many individuals face when dealing with this mystifying condition. To effectively manage it, a unique approach, treatment and coping strategies are required, an approach that takes into account the distinct nature of functional hearing loss. In Part 2, we distinguish functional hearing loss from other types of hearing impairments. Unlike conductive or sensorineural hearing loss, which are caused by physical issues in the ear or neural pathways, functional hearing loss is deemed a psychogenic condition. It sets itself apart even from age-related hearing loss or noise-induced damage, making it imperative for clinicians to identify and understand this difference to provide the correct treatment and support. Part 3 sheds light on the symptoms of functional hearing loss. Individuals may express difficulty with hearing that can't be backed by test results, or show responses to sound that fluctuate or seem inconsistent. It's symptomatic behavior that often doesn't align with other typical hearing disorders, such as struggling to understand speech in specific situations but not in others, without a clear reason. Recognizing these signs early is paramount for effective management. In Part 4, we explore the emotional and social consequences of functional hearing loss. The inability to communicate effectively can take a heavy emotional toll, leading to feelings of frustration, isolation, and helplessness. As social interactions turn challenging, individuals may retreat from conversations and activities, amplifying their feelings of loneliness. It becomes clear why understanding the emotional impact is as crucial as addressing the auditory symptoms. Part 5 dives into how functional hearing loss can significantly impact mental health. Dealing with persistent stress and a misunderstood condition can push individuals towards anxiety and depression. When no clear medical explanation is provided, individuals might feel ignored, which compounds mental health issues, stressing the importance of support beyond just the auditory symptoms. In Part 6, we address the stigma that often accompanies hearing impairment. Those with functional hearing loss battle with judgments and stereotypes, worsening their struggle. Here, we learn how education serves as a powerful tool in combating stigma, paving the way for a more supportive and inclusive environment for those affected. Part 7 brings us to the communication strategies, starting with lip reading. For many with functional hearing loss, interpreting lip movements, facial expressions, and gestures becomes a critical communication aid. We discuss how developing this skill with the aid of a speech therapist or specialized courses can enhance interactions and reduce misunderstandings. In Part 8, we spotlight the role of non-verbal cues and gestures. For individuals with functional hearing loss, body language and facial expressions provide essential context to spoken words. We emphasize the need for both affected individuals and their communication partners to utilize expressive, clear gestures to bridge any communication gaps effectively. Part 9 focuses on how technology can aid communication. Assistive listening devices, ALDs, amplify sound and minimize background noise, aiding conversation focus. We talk about how FM systems, personal amplifiers, or speech-to-text applications can be life-altering in coping with functional hearing loss and the importance of consulting with an audiologist to tailor technological solutions. In Part 10, the spotlight falls on professional support, specifically the role of audiologists. They are at the forefront of diagnosing and managing functional hearing loss, offering specialized tests and guidance on coping strategies. Here, we understand their invaluable input in creating a comprehensive management plan for the condition. Part 11 discusses the importance of counseling and therapy. Therapists specialize in managing the psychological aspects of hearing impairments and can provide coping mechanisms to handle functional hearing loss. We examine how cognitive behavioral therapy and other therapeutic interventions can aid in dealing with associated stress, anxiety, and depression. In Part 12, support groups are portrayed as beacons of hope, offering practical advice and emotional camaraderie. We delve into the benefits of sharing experiences and coping strategies within a community that grasps the unique hurdles of functional hearing loss. Such groups can be indispensable in lessening the sense of isolation. Part 13 explores lifestyle adjustments starting with the home. We cover how environment tweaks, from reducing background noise, using visual alerts to arranging seating for better lip reading, can make daily communication smoother for individuals with functional hearing loss. In Part 14, we tackle professional and educational accommodations. Transparent communication about the condition can lead to necessary adjustments such as note-taking support or the use of ALDs. These changes are crucial in ensuring equal access to information and opportunities for success. Part 15 addresses navigating social gatherings with functional hearing loss. Planning, communicating needs, selecting quieter venues, and sitting in well-lit areas are among strategies that can make these settings more manageable. Being upfront about the condition encourages clearer communication, allowing for better social engagement. Coming up in Part 16, we explore how education is key in fostering understanding within personal relationships. We discuss how enlightening loved ones about the condition and offering communication tips can significantly improve social interactions and build supportive networks. In Part 17, establishing clear communication guidelines is showcased as pivotal for reducing misunderstandings. We delve into how setting these guidelines collaboratively can lead to more fulfilling relationships for individuals with functional hearing loss. Part 18 emphasizes the virtues of patience and empathy. They are foundational in creating a supportive environment for communication. Recognizing each other's communication efforts builds respect and understanding, strengthening personal bonds significantly. In Part 19, we underscore the importance of self-care. Engaging in stress relief activities helps maintain emotional balance and improves well-being, an important factor in handling the daily challenges of functional hearing loss. Part 20 dives into how mindfulness and meditation can assist individuals with functional hearing loss. Regularly practicing these techniques reinforces living in the present moment and fosters an awareness that can lead to a calmer approach to life's challenges, including those associated with hearing impairment. In Part 21, maintaining good physical health is discussed as a cornerstone of managing functional hearing loss. Regular checkups, balanced diets, and avoiding ototoxic substances contribute to overall health, indirectly supporting better management of the condition. Part 22 focuses on staying updated with emerging treatments and technologies that can benefit functional hearing loss. Keeping abreast of medical advancements offers new possibilities for managing the condition and improving quality of life. In Part 23, the power of advocacy is brought to light. By pushing for rights and accommodations in various spaces, individuals can catalyze social change, creating a more aware and accommodating society for those with hearing loss. Lastly, Part 24 covers building resilience and maintaining a positive outlook. Embracing the condition and focusing on personal growth can foster empowerment. With resilience, individuals can confidently navigate their future, armed with the necessary tools and support.